हेलो गुड मॉर्निंग, मैं सिर्फ आर्यन और आज हम डिस्कस करेंगे मेडिसिन के सम इम्पोर्टेंट एमसीक्यू। आइडेंटिफाई द साइन रिलेटेड टू अ laryngocoele, voice sign, bright sign, swart sign, and none of the above. The best example is the laryngocoele is the bright sign because the bright sign is a compression may empty air and fluid and the fluid into the larynx, producing hissing sound. Producing which sound? Hissing sound. Producing hissing sound is seen in laryngocoele. Next question. All of the following are true regarding anticoagulants used in pregnant women with prosthetic valve except warfarin is the most effective anticoagulant for preventing maternal thromboembolic complication. Yes, heparin is less hazardous for the fetus. Yes, and heparin needs to discontinue just before delivery. Yes, warfarin is contraindicated during breastfeeding. This one is the answer because the UFH unfractionated heparin and low molecular weight heparin and warfarin therapy is not contraindicated in breast feeding, which UFH and LMWH and warfarin are not contraindicated in breastfeeding. A patient of acute leukemia is admitted with febrile neutropenia on day 4 of being treated with the broad spectrum antibody. His fever increases, X-ray chest so bilateral fluff infiltrate. Which of the following should be the most appropriate next step in the management? Add antiviral therapy, add antifungal therapy, add cortimogazole and continue chemotherapy. The best answer is the add cortimogazole because the history of acute leukemia with the febrile neutropenia means immunocompromised state है with the bilateral floppy infiltrate on chest X-ray and failing to improve with broad spectrum antibiotic probably given clue that a patient is suffering pulmonary infection. Pulmonary infection due to P0AC. P0AC. Here the most appropriate line of treatment with additional cortimogazole. Cortimogazole treatment. Next question. Preiser disease is osteochondritis of the calcium apophysis, no traumatic avascular necrosis of the scaphoid, no atraumatic avascular necrosis of the scaphoid. Yes, is the right answer. Because the Preiser disease is the atraumatic avascular necrosis of scaphoid osteonecrosis. It is mainly present in कहाँ होता है? Wrist pain. कहाँ होता है? Wrist pain. इन्वेस्टिगेशन क्या क्या करेंगे? प्लेन रेडियोग्राफ CT and MRI. Next question. Which of the following is false about secretin? Inhibit gastric impacting inhibit insulin secretion. This one is the false because the secretin is secreted by S cells that are located deep in the gland of mucosa of the upper portion of small intestine. Upper portion of small intestine. The secretion of secretin is increased by the product of protein digest and by the acid bathing by the mucosa and upper small intestine. Function increase the secretion of bicarbonate, decrease gastric acid secretion, stimulate insulin and inhibit glucagon secretion, augments the action of CCK. Next question. Which of the following statements is true about the ethmoidal polyp? Energy is an etiological factor. It is unilateral. It is seen in the usually seen in all of the above. This one is the best answer. Is the allergy is an etiological polyp because the allergy is the main etiological factor for ethmoidal polyp. It is usually multiple, bilateral, and more common in the middle-aged. Individuals. So मेन etiology factor अगर कोई पूछेगा वो क्या है? एलर्जी यूजली अफेक्ट मिडल एज को करता है. साइट ऑफ ओरिजिन लैटरल वॉल ऑफ द नोज. कहाँ पे होता है साइट ऑफ ओरिजिन? लैटरल वॉल ऑफ द नोज. clinical feature: nasal stiffness, headache due to sinusitis, sneezing, watery nasal finding. Investigation of choice: NCCT. Investigation NCCT. Treatment of choice क्या है? FESS. So today that's all. Thank you and keep watching.